So 3 out of 1,000 children who are born with cerebral palsy. Still, we do not know what exactly is cerebral palsy. Cerebral is something related to the brain, and palsy refers to some difficulty which is happening with movements. So cerebral palsy is something related which has difficulty in movements. We have Dr. Karuna Nikam Singh here. So thank you, ma'am, for giving us your valuable time. She is a certified neurodevelopmental therapist, and she's been treating a lot of patients since the last 19 years who have neurodevelopmental disorders. She is also certified in sensory integration program and other techniques like what can be done for decoding autism. And she's seen several patients who have been suffering and who have had cerebral palsy. So thank you, ma'am, for sharing, for coming here and sharing your time with us. So we are here for understanding what is exactly cerebral palsy and what can be done at an early stage to prevent cerebral palsy. So can you just explain the audience in brief about what exactly is cerebral palsy?
Good afternoon all. Thank you, Dr. Apurva, for the wonderful introduction, and thank you for taking this opportunity to create awareness.
Yes.
Since March is Cerebral Palsy Awareness Month, I would like to stress on the word cerebral palsy awareness because all these days are marked to create awareness for the common people.
Yes.
These are not celebrated. So I am glad that you mentioned that it is awareness. And you have answered your question, cerebral palsy broken into two. Let us go back and understand where did it all begin. It was Sir John Little and Sir William Osler who have really put in a lot of efforts in finding out and identifying cerebral palsy. Now it is known as cerebral palsy, but it originated as cerebral paralysis.
Okay.
So what happens in cerebral palsy is when the child, either during birth or when it is in the mother's womb, जेव्हा आईच्या कुशीत आहे किंवा जन्म घेताना, that is the time that the baby has some accident, and when I say accident, it could be lack of oxygen, which is called as hypoxia. The baby may have an entangled placenta, the cord, and then for any reason when the baby is deprived of oxygen supply, then the baby has some lesion in the brain. So brain, then the cerebral word justifies that. And then, as we all know that the brain controls the motor functions of your body, the movements of your body. So when you have some affection or a lesion in the cerebral area, you will see the effects on the movements. So the child's movements will be impaired, right? So this is what cerebral palsy is, briefly.
Okay. So as ma'am mentioned that it is difficulty in movements because there is some lesion with the cerebral area. So ma'am, can you just elaborate on, is it just the functioning, the movements which are affected, or are there any other related conditions also, like affection in the intelligent quotient, or difference in urine and bladder bowel controls? Is there anything like that?
Okay. And now, cerebral palsy impairments, when I say impairments, means the affection. How badly is the child affected depends on the site of lesion. Okay, and that will decide the amount of affection. Now coming to whether the child will have multiple issues, I would say yes. It is very rare that you have just movement disorder. Mainly seen in diplegics. When I say diplegics, means the only lower limbs of the baby is affected, and most of the time they are good with intellect. The cognition is not so affected, but there are certain times that you see a global affection where yes, the movement is affected because there is a abnormality in the tone. You have cognition affected. That's why the child may lack in academic skills. Many times there are a lot of sensory concerns, and with spending so many years with children with neuromotor disorders, the biggest learning for me is it never happens in isolation. You never have only movement disorder and there is no sensory involvement. So Most of the time, answering to you, it is a combination. Yes.
So, what generally are the risk factors for a child to be born with CP? Like, is the mother's nutrition, or what can be done to prevent this from happening?
Yes, what you said, I would like to highlight that the mother's nutrition plays a very critical role in the whole array of neurodevelopmental disorders. It's not only CP, okay? If the mother is well taken care of when the baby is in the womb, we can prevent a lot of neurodevelopmental disorders. Cerebral palsy, as you said in your introduction, that it is 2.5 to 3 out of 1,000 live births. But what we are seeing in the last decade, there is a lot of various neurodevelopmental disorders that we are seeing. It could be minor neurological disorders and something as a very severe syndromes. A lot of syndromes have surfaced in the last decade, I would say. So the best prevention, I feel, is good care of the mother when the baby is in the womb, and a good support system in case there are certain accidents. If there is any asphyxia, if the baby has a good infrastructure, a good hospital which can manage it in time. What important thing here is about how is the baby getting the intervention, and most critical is when. The earlier the intervention, the lesser the amount of impairments.
Right. So when you talk about nutrition for mothers, can you just guide a few pointers about what exactly has to be considered in nutrition for mothers?
Now, I would like to share with you in the research that is specifically happening for our country in the last, you can say 5 to 7 years in the early intervention area. What we have realized is mothers, especially from the rural background, who are low with basic parameters. When I say basic parameters, are your vitamin B12, your folic acids, your hemoglobin, even such basic things, if they are not in the well marked space for the mother, and she is being consistently deficient, we have seen children showing developmental delays in life, which with intervention are corrected. But very small, whatever our country has been following for care of a pregnant woman is wonderful. Even from the baby point of view, we will talk about it someday later, but whatever knowledge we have, if we just keep all that basic things in mind about the mother's nutrition, even that is enough. We have a lot of supplements given in the rural areas by the government hospitals. Even we have them here. If the mother is specific about taking those supplements, because you are nourishing 2 lives, we have to understand. And if you give it enough, I think a lot of things can be prevented. What we cannot prevent is during the birth, if the child has asphyxia or hypoxic injury, or there's a cord entangles. These are accidents. There are certain infections which you can find out, like if you do a torch test, you understand that there's going to be some neurological disorder. If you find out that there's rubella infection. But this all can be, you need to have a good rapport with your gynecologist and get all this tested in time. Especially when you are a first time mom.
So speaking about tests, are there any specific developmental screening tests which are being missed out, which leads to these neurodevelopmental issues? And are there any specific tests that are like must do, which has to be done during these during the period of conception?
Okay, so during pregnancy, as I said, you have the most important is your anomaly scan that is done. But it will not really help big time with CP, but it does help with if there is intrauterine growth retardation that is seen, that is very well picked up. It helps a lot to do it in case of Downs You can find out if your baby is Downs or no with the test that happened. But with CP, there is no specific test as such.
Yes.
Because as I said, it is happening because of certain issues that are happening during the birth. And in case there were certain long-standing deficiencies or infections the mother has had.
So now that the child is born, is there any specific things or markers that a mother and her family has to remember, so that the early diagnosis is being done, so that we can start the intervention as soon as possible?
This is my favorite question, and I love to answer this at length, because we all put in efforts after it is too late.
Yes.
So we can identify CP as early as 3 to 5 months of age.
Okay.
Without any invasive test. When I say it is a non-invasive, that means you don't have to undergo any machines. There is no, blood samples that are required. What you do is just watch the baby move.
Yes.
And the baby's movements are broken down into small fragments, and the quality of the movement, the quantity of movement, and how subtle, beautiful they are, even that gives a lot of cues whether the baby is doing well motor wise. Even through these tests you can even identify whether the baby is going to have any communication disorder, if the baby is going to have any learning disorders. You have specialists who do this test.
Yes.
And it is super convenient. All you need to do is watch your baby moving, the innate movements. When I say innate movements, you are not giving any toy, just the baby when is awake, completely awake, moving on its own. If you ask me, what should the guardians be worried about? Like if you have your baby already becoming 3 months and the head is still lagging behind, okay, if there is no good head control, there's no nice smile, there's no initiation of eye contact. If you feel, especially your grandmothers in the house, or the lady who is doing the malish of the baby, which is quite common in our country, if she says that I feel that the baby resists, बाळाचे हातपाय हलताना घट्ट वाटते, मी काहीतरी हालचाल करायला जाते तर बाळ कडक होतंय. These are the red flags, and please report it to your pediatrician or your clinician whom you are taking your basic care with, and they can help you definitely. But as parents, if you see that there are sudden muscle tone change, suddenly तुमच्या बाळाचा जो मसलचा टोन आहे तो सडनली कडक होतो किंवा फारच लूज होतो, एकदमच असा ज्याच्यात जीव नसल्यासारखा, एकदमच फ्लॉपी ज्याला आपण म्हणतो. I think these are the things that should put you on an alert. If you have feeding difficulties with the baby, if the baby is not latching well on the nipple of the mother, please seek guidance, because this is the most crucial time to receive nourishment. And if you miss on to it, you are going to face issues. So I feel the first 5 months of the baby's life are very important, and they give you all alarms. We need to be aware.
So as ma'am beautifully explained here, like understanding those alarms are really, really important. Here we are highlighting on the points that we have to listen and we have to understand what are the alarms. The tone of the baby, head falling, not under control, or suddenly the arms are resisting the movements, or the nutrition, the baby not latching. All these are alarm signs, and the parent has to be aware that these are the red flags, after which they have to immediately consult their doctors. Otherwise it may be too late.
I would like to add here, if you have a baby who is finding it difficult to fall asleep, we have several babies who are little cranky, and the sleep patterns are erratic. And in all these years, what I've seen is babies who have had erratic sleep cycles have had certain issues with hyperactivity.
So when you say erratic sleep cycle, so does that mean that the baby, because we have seen a lot of parents complaining that the baby sleeps throughout the day, but the night he is not sleeping. So is what you mean by
Well, it's
erratic?
not about the night or the day, you know. Even if the baby is well fed, if the baby has no colic, most of the time the baby has acid reflux, there is colic in this age.
Yes.
But if the baby has no issues from the other two fronts, but still the baby continues to be cranky. You know, the movement disorder is continuously happening with the baby, especially when the baby is going to be awake. Yeah, and that is where the baby turns out to be little cranky and finds it difficult to sleep.
Right.
And then we should try and find out why is this happening.
Yes. So, summing up our thing, like you being a neurodevelopmental therapist and practicing since so many years, there is a question which comes up in every parent's mind, whether my child can be absolutely normal, and for that, what can we as parents do? So, can you just elaborate and what expectations have to be kept? Of course, it is going to be different from children to children. Every child is different. But, is there a hope and what can be done for that?
Well, let me answer it in two parts, okay? The question of whether it's going to be normal. First of all, we need to redefine the normality. First, the first responsibility that comes to you and me. Normal is going to be individual for that child. As per that child's impairment, I have really seen sad things happening with children. The children is a severe acetoid dystonic CP. When I say severe acetoid, that means every time the child is trying to do, the movements are not in their control. And such children are forced to achieve certain physical goals. Please let us have goals which are adequate as per the child's impairments. Let us be fair.
Yes.
What in long term we need to look at, give the child as much as independence possible in terms of ambulation. The child should be able to sit, walk, should be able to eat by themselves if he or she can manage their ADLs.
Yes.
And this all depends on what type of CP it is and how gross is the involvement neurologically.
Yes.
Right? And coming to the lifespan, this is what you wanted to know.
The quality of life.
The quality of life is how supportive can the parents, the guardians, and all of us can be to the child.
Yes.
We have to accept the child.
Yes.
We have to encourage our children to be with them because most of these children are mentally good.
Yes.
They want friends. They want people. And as if we can have realistic goals, I think we can give a better life to the child.
Yes.
Most of the time, we are hungry to see the child do something and forget that what is the child's ability. Let's respect their abilities and let us set goals as per their abilities. And trust me, all of them do wonderful.
Yes.
All of them do wonderful.
So ma'am has just beautifully explained about how we are supposed to set realistic goals which are within the child's reach. So if we set realistic goals which a child can achieve, then that is what we need. Just making the child independent so that as much as possible, so at least he is able to walk on his own, have bath or eat properly on his own. That is what we should aim for. Of course, every child is different, so we have to identify where our child is special at, and that is that area which we need to make it shine. So thank you so much ma'am for giving such beautiful guidance about what exactly is cerebral palsy and what are the movement dysfunctions, what exactly happens in that, and most importantly how important is nutrition, how important is understanding the red flags here, and what can a child with CP actually achieve in his life. So thank you so much, and we hope that a lot of people, a lot of children get better with your guidance. Thank you so much.
Thank you. Bye-bye.